Now, an Emeritus Newsbrief Weekend Edition, a wrap-up of the week's top issues and public policy developments. I'm Lynn Huston. It was a really rough week for President Bush. Not only didn't he get the economic bailout plan that he wanted, but a lot of the party faithful left him. Democratic leaders in Congress say the way it is now, nobody from any party has enough votes for any plan to even bring one up for a vote. Things seem to go downhill right after the meeting with the president. A visibly aggravated Republican Senator Richard Shelby defiantly said after the meeting with Bush at the White House that there was no deal and that he probably would not be invited back again. The unpopular parts of the economic bailout proposal? Well, the power given to Treasury Secretary Henry Paulson to determine the use of the $700 billion. White House demands that Congress cannot limit some aspects of payments to departing executives from failed companies. Democratic leaders don't want to hold a vote when the White House can't deliver a majority of the Republicans. The Federal Reserve announced that 4 overseas banks from the Nordic regions have pledged $30 billion. That money will be used, if needed, to back up the U.S. financial system. Other major developments from the week, a lot of legislation that has passed at least one House of Congress, in some cases both, and likely to get the signatures of President Bush. The Veterans Cost of Living Adjustment Act of 2008 has been signed by President Bush. The increase will be determined by the cost of living rate given Social Security beneficiaries. The Department of Veterans Affairs grants disability status to veterans suffering from Lou Gehrig's disease or amyotrophic lateral sclerosis, and some veterans with qualifying traumatic brain injuries. See the Emeritus News homepage for details. The Department of Veterans Affairs also announced a $36 million program to provide housing and other assistance for homeless veterans. Also, the Veterans Mental Health and Other Improvements Act has passed both the House and Senate now, but differences are still to be resolved. The act expands mental health and substance abuse treatment and post-traumatic stress disorder research, and provides temporary disability ratings, improved home loans, and housing assistance. The U.S. House has passed and sent to the Senate the Elder Abuse Victims Act of 2008. It's the first Elder Abuse Act passed in 17 years. It provides money for additional enforcement and pays to train advocates for the elderly, law enforcement, and those working in health care. The just-released Kaiser Family Foundation Employer Health Insurance Survey shows that premiums will increase next year an average of 5%, but more employers are switching to large deductible and copay plans. The Committee to Preserve Social Security and Medicare says that Americans 55 and older have seen the sharpest increase in bankruptcy filings than any other age group in the past 10 years. Homeowners over the age of 50 account for an estimated 28% of all delinquencies and foreclosures. That's 684,000 older Americans who have already lost their homes or are in danger of losing them now. The Census Bureau has released an interesting study about aging baby boomers in the workforce in 30 states. The Bureau claims that more Americans 55 years and older will remain in the job market well beyond retirement age. This is due to 401k portfolio losses as well as a shortage of educated workforce. In most areas, Americans 55 and older currently suffer more job losses than any other age group. Federal employees face an average increase in their health insurance premiums of about 7% or more. According to the Office of Personnel Management, the average enrollee's share of the premium increase will be 7.9%. The Blue Cross Blue Shield self-only standard option will be up 12.9%. The same plan with the employee and family coverage up 13.4%. The Centers for Disease Control and Health and Human Services announced programs totaling a combined $130 million, the CDC awarding $24 million for pilot programs in various states to plan for flu pandemics. And Health and Human Services spends $105 million to treat drug addiction and HIV in underserved minority areas. Emeritus News, the latest on issues and public policy developments, news you won't get anywhere else. That's an Emeritus Newsbrief Weekend Edition. I'm Lynn Huston.